Hi everyone, Dr. Emeka here again. If you're new on this channel, welcome. Please click on the subscribe button, turn on your bell notification so that anytime I drop videos, you will be notified. Like and share this video. Please subscribe. Let's talk about a condition called pseudotumor cerebri or idiopathic intracranial hypertension. In some patients, headaches, vision problem, and ringing in the ear can be due to a condition called pseudotumor cerebri or idiopathic intracranial hypertension. So, what is it and how is it diagnosed? The idea is that some patients with the symptoms that I mentioned would have inside their head high pressure. They will suddenly have high pressure in the head, you know, and for some reason, and if we do not know the cause of this pressure in the head, then we say it is idiopathic. That is where we get the term idiopathic intracranial hypertension, meaning pressure, high pressure inside the head. It can be due to blockage of blood flow from the brain. Okay, blood flow that is leaving the brain. It could be there is a blockage. It could be due to some form of tumor or some medication that an individual is using, or maybe due to some endocrine problem because this condition is mostly common among women. So, how do we diagnose this? Well, the first part of the diagnosis is to do a CT scan of the brain or an MRI scan of the brain. Okay, the fluid space in the brain is called the ventricles. So, in this kind of patient, the ventricles are either small in size or they are of normal size. Now, if you do a scan, either a CT scan or an MRI for this patient, you will not see anything on it. You will not see any mass, no tumor, no, you won't see nothing. However, we would further do another investigation to be able to do the diagnosis. So we do what is called a spinal tap. We go behind and go to the level of L3, L4 spine, and then push in a needle to get the CSF or the cerebrospinal fluid. Okay, then we'll now measure it to check for the pressure. If the pressure is more than 25 centimeter of water, then that is hypertension in the brain. So the hypertension, is not just in the heart, it's hypertension in the brain. If the measurement is more than 25 centimeter of water. So what patients should do if they have this kind of condition is to possibly check with the ophthalmologist to do eye examination. The ophthalmologist will do what is called fundoscopy to look at the back of the eye, the back of the retina, to check if there's any swelling or maybe papillary edema. Because if there is any papillary edema or swelling of the eyes, it can compress on the optic nerve, which helps us to see. And that might lead to eye problem. In fact, it can even lead to blindness. So it is very important to do eye examination. Another thing that is very important to do is uh, venogram to look at the veins that is draining blood from the head to see if there's any occlusion or blockage of any kind in order not to cause problem um, with the site. So it is important to do this scan, MRI scan, and very important the lumbar puncture, to check um, for abnormal cells or maybe an increased glucose in the cerebrospinal fluid. The cerebrospinal fluid is the CSF that is tapped and measured to check for pressure. You see, all these are investigations that are very, very important in diagnosing patients with this idiopathic intracranial hypertension because somebody will be complaining of headache and they'll be using paracetamol, using painkiller, and all that, but it's not working. So you need to further diagnose it to be sure why this person is having headache. So sometimes the headache you may be having might not stop because you are using paracetamol, you're using all sorts of pain medication, but it's not stopping. Further investigation need to be done because you never know. It might be idiopathic intracranial hypertension due to high pressure in your brain. So, how do we treat patients with this condition? I mean, idiopathic intracranial hypertension or pseudotumor cerebri. Well, about 90% of patients with this condition are mostly women, women who are overweight or obese. So this is that patients should try to lose about 10 kg of their body weight, okay, in order to improve the condition, all right, so that the pressure in the head can decrease. We also give medications like acetazolamide or Diamox. We also give topiramate as well for patient. The other option we offer patient is surgery. So we do what is called VP shunt, ventriculoperitoneal shunt, where we insert a tube in the brain in order to drain the CSF or the fluid from the brain down to the abdomen so that the pressure in the brain can decrease. Okay, that is the whole idea. But most importantly, the VP shunt itself or the surgery has about 50% failure rate because the patient might possibly need or require a second surgery. So the advice is that patients who have this condition, idiopathic intracranial hypertension, should try to have lifestyle modification. Whatever you eating that is making you get obese, you decrease or you stop it. You need to talk to a nutritionist who will help you modify your diet. Get involved in outdoor activities, do a lot of exercises in order to reduce your weight. That's how you manage this. So, in summarizing this whole discussion about pseudotumor cerebri or in idiopathic intracranial hypertension, which is of unknown origin because we do not know what causes that, it is important for patients who are obese, women who are obese and are having headache, and they've been taking medication like pain medication, paracetamol, and etc. And if it does not stop, it's time to see a neurosurgeon who will help you with the diagnosis. There are quite a number of investigations that we do. We do blood works, we do LP, we do spinal tap. We go to the back of the spine and take the CSF and measure it to see if there's high pressure in the head or not. We also do some other investigation like images, MRI, venogram to check if there's a blockage of vessel coming from the brain. Okay, we also refer patient to the ophthalmologist to go and check the back of the retina. We do fundoscopy to check the back of the retina if there's swelling or papillary edema. Because if there is papillary edema, it can compress on the optic nerve, and that's the nerve that helps us to see. So patient can even start seeing double vision, or diplopia, or can lead to even blindness if care is not taken. So it's important for patients to be very, very careful and be intentional, especially for obese patients who have been having severe headache. You need to see a neurosurgeon to help you with this diagnosis. There are other things we do, we also do a VP shunt, which is a surgery, and that's the last recommendation we give to our patient. This VP shunt is when we pass in a tube in the brain and then drop it inside the abdomen. The idea is that it will help to drain the CSF from the brain down to the abdomen, thereby reversing the symptoms. Because when the fluid is draining from the brain back to the abdomen, it will reverse the symptoms, and patient will start feeling better. The pressure in the brain will decrease, and patient will stop having headache. So if you're experiencing all these symptoms, you need urgently to see a doctor to help you out. You need to speak to a neurosurgeon. Very important. Don't forget that. So the primary focus or the advice that we also give patients is that patients need to be involved in their in taking care of themselves in terms of losing the weight, body weight. If patient lose about 10 kilogram of body weight, it is in the literature that the symptoms will reverse and their health will improve significantly. So patient need to see nutritionist who would help them modify their diet and also get involved in outdoor events, involved in exercises in order to improve your health. It is important that patients try to lose weight and be intentional with whatever thing that they are eating, which is making them to add weight. So our focus in this discussion is that patients who are obese, women, and are experiencing headache should urgently see a doctor. I hope you enjoyed this video. If you do, please click on the subscribe button, turn on your bell notification so that anytime I drop videos, you'll be notified. Like and share this video. Please subscribe. See you in my next video. At the